So let us start with the introduction of the human anatomy. By the end of today's lecture, you'll be familiar with definitions, various subdivisions, history of anatomy which is very rich, the language of anatomy with respect to planes, common term used in anatomy, various movements, and terms related with the clinical anatomy. Anatomy is defined as the science which deals with the structural organization of the living being. Here we study the structures of the human body. The word anatome is from the Greek term that means to cut up, and dissection is a Latin equivalent of that term. Anatomy can be studied under various subdivisions. The first is cadaveric anatomy. This is to study of the structure by dissection. It is also called macroscopic or gross anatomy. Dissection can be done by regions or by the systems of the body, but the commonly used method is regional dissection. There is one other part is cross-sectional anatomy, where the sections of the body are studied. Living anatomy is a study of structures on living being by inspection, palpation, percussion, and auscultation. We can also use certain scopes to visualize those structures. Otoscope for visualization of external ear, and bronchoscope for the study of tracheobronchial tree. Embryology or developmental anatomy is the study of prenatal development of an organism. Microscopic or histology, this is the study of tissues under the microscope. Surface anatomy is a study of the internal organs with respect to the surface of the body. Then comes radiographic anatomy, which is also imaging anatomy, where we study structures based on X-ray, USG, CT scan, and MRI. Applied anatomy is the application of anatomy knowledge into clinical side. Example, spinal cord ends at lower border of L1 that helps us in the lumbar puncture. So this is the application of anatomy on clinical side, that is applied anatomy. Then comes experimental anatomy, where experiments are done to understand the various structures of the body. Genetics is a science of hereditary, study of chromosomes, karyotypes, and its abnormality on the patients. Comparative anatomy is a study of structures and comparing with various animals to understand the evolution and function of particular structure in the human body. So this is comparative anatomy of teeth. Why teeth are so different in different animals? Physical anthropology is a measurement of various parts of the body of different human races and with other animals. So these are the different methods by which we can study human anatomy. Now, before we go forward, there are two concepts we need to understand. The first is homology versus analogy, and second is ontogeny repeats phylogeny. Let us understand first homology versus analogy. Homology means same origin, different function, and analogy means same function but different origin. Let us try to understand this thing. As you see in this image, the limbs of different animals are shown. A limb of a human, a cat, a whale, and a bat. If you see the structure of inside these limbs, proximally there is one bone in all the limbs, middle area there are two bones, and distally there are smaller numerous bones. So structurally all the limbs are similar, and functionally they are different. The human limb is for prehensile, the cat limb is for running faster, catching the prey, the whale limb is for swimming, and the bat limb is for flying. So different function but structurally same, so that is called homologous structure. So this is a classical example of homology. Another is again compared with the wing of a bat and a bird. Structurally it is same, functionally also it is same, so this is a homologous structure. But if you compare the wing of an insect, functionally they are similar structure, that is for flying, but structurally there is no similarity with the insect wing and a bird wing. So this is analogous structure. The limb of a spider and the limb of a dog is definitely used for locomotion, but structurally there is no similarity. So that's an example of analogy. Now let us move on to ontogeny repeats phylogeny. This was given by German zoologist Ernst Haeckel. Ontogeny means a development of an individual organism over its lifetime, that is a prenatal development, a development after the birth till the organism dies is called ontogeny. And phylogeny is the whole evolutionary development of that particular organism. Let us try to understand these two terms a little bit in detail. And in the next figure, you will see on the right side, this is the development of embryo of the human. So the development of the organism is ontogeny. And this is the whole development of an organism by evolutionary process from fish to amphibians to reptiles to mammals, and that is what is called phylogeny. So by the saying, it says that ontogeny repeats phylogeny means in our own one life cycle, the whole evolutionary life cycle is repeated. Let me give the example that in the embryo of the human being at one point of time, even gills appear there, and that is a feature of a fish which disappears after some time. Tail appears, a feature of a reptile, disappears after some time. And one another example is the development of ear. In fish there is only internal ear, in amphibians and reptiles there is middle ear, and in mammals there is external ear. So this is the same way the development of ear follows. The first to develop is internal ear, then middle ear develops, and then external ear develops. So ontogeny repeats phylogeny. Wait a minute, what is this? And this, and this. Would you like to guess? Let me tell you, the first image that you see is of Graham Bell. Okay, you guessed it right. So that is the first telephone. The second image is the first steam engine automobile. And the third figure is the first flight by the Wright brothers. So first telephone evolved into first mobile phone, car into the first fuel cell car, and the plane into the first jet engine plane. We know that telephone evolved into something like this now, car evolved into something like this, and plane evolved into something like this. So this is the evolution of science. And anatomy is a science, and no science is complete without knowing its history of evolution. So let us try to understand a rich and prestigious history of human anatomy. I've divided the history into two parts. One is before Christ and another part is after Christ. So this part of our history will end at the birth of Christ. But where does it start from? It starts from the beginning of human civilization. At the beginning of human civilization, the earlier human beings had an idea that there are certain vital body parts, and if you hit those vital body parts, the animal is going to die soon. This knowledge they also applied in the intertribal war. So it was art of killing and not the science of healing that we see now. Then in China, in 2700 to 2600 BC, the earliest book on human anatomy was written called Neijing. And then there was a time of the greatest Egyptian civilization. It was not their architectural genius that still surprises humans now. It was not only the building of pyramid that surprises us, but it is their knowledge of human anatomy is still very mysterious. They had a social practice of mummification where they could preserve the dead body for thousands of years. They believed that their pharaohs, when they go to heaven, they need everything that they use in this life. So what they would do is they would take out the human parts from the body, preserve some of the internal organs which are easily decomposed, put up in the jar surrounding the body, and rest of the body they would tape it with certain chemicals, and those chemicals are still not very well understood, and because of those chemicals the bodies of their pharaohs are preserved for thousands of years till now. One of the famous mummy is mummy of Tutankhamun. So these were Egyptians. Then comes the time of India. In 1000 BC or up till 3rd to 5th century, the Ayurvedic system of Dhanvantri flourished very well in the country. Sushruta, who is considered to be the father of Indian surgery, practiced purposeful dissection. He also conducted first surgery on intestinal obstruction. He gave a detailed view of the aseptic precaution that one should take before the surgery. And then came one of the greatest philosopher and physician of the Roman era. He is considered to be father of medicine, and yes, he is Hippocrates. He is also called as a founder of anatomy because he gave guidelines for dissection. He used the bodies from the battlefield. Aristotle is the one who gave the term anatomy. First ever account of the embryology. You can see on the right side there is a crude figure of an embryo. But one thing interesting is that he believed heart as a center of intelligence and emotions. So all the way from Aristotle's time till now, whenever we talk about love or emotion, that is always related with heart. So all the poems that we write, all the books that we write, when we talk about emotion, it is related with the heart on Valentine's Day or any other day. So that's all the way from Aristotle. Then comes Herophilus. He is the father of anatomy. He dissected criminals. It was not actually dissection, but it was vivisection, where Herophilus and Aristratus took a special permission from Ptolemaic dynasty of that time, and they actually do the dissection on the living criminals of that time. They were doing dissection when they were living, and he regarded brain as a seat of intelligence. So this was Herophilus. And after Herophilus, there was a birth of Christ, and that is where our first part of the history ends, at the birth of Christ. So first part is ended, and the next part starts after the birth of Christ. That is said AD, commonly thought as after death, but actually it is Anno Domini, that means year of Lord. So this will start at the birth of Christ and it will end in the modern era. The first one is the Galen of Pergamum. He is considered to be the prince of physicians. He dissected animals and monkeys, and based on the dissection of monkeys and animals, he tried to correlate the anatomy with the human being. He never thought of a pulmonary circulation, but he gave important structure and detailed structure of spinal cord and nervous system. For next 1300 years, whatever Galen said was accepted all around the world by various physicians and anatomists, and that's why it is called Galenic Age. But whatever Galen said was not always true, because he correlated with the animals. As you can see in this figure, the structure of human body that he showed was not totally true. After Galen, then came a time where Pope Boniface prohibited all human dissection. And then comes this guy. Would you like to guess who is he? Okay, let me show you this. I'm sure you'll be able to guess him by this image. Yes, you guessed it right. He is the Leonardo da Vinci. He is the greatest sculptor, the greatest scientist, the greatest mathematician, physician, writer, philosopher of all time. He was also one of the greatest anatomists of his time. So here you can see some of the anatomy drawings that were done by him, which were all found after 160 years after the death of Leonardo da Vinci. Only a genius like him can draw a human anatomy with so accuracy. Then comes the father of modern anatomy is Andreas Vesalius. Now Vesalius discarded all previous theories in anatomy because he always found some or the other defect in previous anatomy descriptions. So what he decided to dissect human bodies by himself by special permission from the church, and then ultimately he wrote a book called De Humane Corporis Fabrica, and in this book he gave the detailed view of the structures of the human body. And the structures that he described were so accurate that till now today, whatever anatomy we study is been taken from his book and still modified whatever is there to be modified. So Vesalius is one of the greatest anatomists of all time, considered as father of the modern anatomy. And then came William Harvey. Now William Harvey described correctly in detail the systemic circulation and properties of blood being pumped into the body by heart. In his book on the motion of heart and blood, till that time the theory that was not understood he described. But there are two things that he could not explain till then was, first, why was there a need for the blood circulation in the body? Now that theory could not be described because the first and the foremost thing was oxygen was not discovered till then. Oxygen got discovered in 1773 by C. Cecil, a German scientist. Another thing that he could not describe was capillary circulation because capillaries were identified in microscope by Malfigi much later. Then in 1750 to 1832, a lot of activity in body stealing started. Now because of increased demand in the medical world for the bodies to dissect, people started stealing the bodies. And one of the famous case of that time was by two friends, William Hare and William Burke. Now these two people, they used to run a small hotel in the old England, and in that hotel, whenever an old person or a sick person comes to the hotel, what they would do is they would kill that person for dissection. After killing that person, the body was being sold to an anatomist of that time, and the anatomist, his name was Robert Knox. He would buy the dead bodies from Burke and Hare for around 7 to 10 pounds. And this murders became so sensation in UK of the United Kingdom of that time that ultimately, because of public pressure in 1832, a Warburton Anatomy Act came into existence. The act allowed the use of dead bodies which are unclaimed. So we follow that till now. And then came Gregor John Mendel, who is a father of genetics. He was an Austrian monk and a biologist. While working in the garden of the church, he gave all the theory, and that is called Mendelian laws. Then after Mendel was a time of Charles Darwin. He gave the theory of evolution, where he said that all species of life have descended over the time from a common ancestor. He believed that human beings evolved from the monkeys, and when he presented that paper next day in the newspapers, this photograph came where they said that Charles Darwin evolved from monkeys. So after Charles Darwin, there was invention of X-ray by William Röntgen. He got the first Nobel Prize in the physics in 1901, and this is the X-ray of the first X-ray that he took was the hand of his wife. After X-rays was DNA structure, where double helical structure was given by Watson and Crick. And then there was a lot of development in the field of genetics. An Indian scientist, Hargobind Khurana, who created first artificial gene in the lab, was awarded Nobel Prize in Medicine in 1968. He was also awarded Padma Vibhushan in 1972. And after that, a lot of development happened in the field of genetics. So 11 Nobel Prize for the scientists in the field of genetics are given in last 30 years. Then in 1990, a human genome project was started. So this project was to identify the total number of base pairs in the human DNA. The project was to be conducted for 15 years, but in 2000, within 10 years, the Human Genome Project was ready, presented to the world in 2003. According to this, the human DNA contains 3.5 billion base pairs. So we saw in the history there were so many anatomists from different parts of the world and different times. So all these anatomists gave the terms in Greek, Latin, Old English, New English, French, and so on. So these were not allowed. For a single part, all different terms. So what was required? Standardization of the anatomical terms. We know the importance of standardization, right? We see these signals. A green signal means go, and red signal means stop. As a driver, you drive in any part of the world, the standard signals are being followed. There are certain standards for certain other things also. Standardization of anatomical terms were also required, and the first meeting that happened was in Basel in Switzerland. And in the first meeting, what happened was, from the 50,000 terms used at that time, after standardization, the total number of terms were reduced to 5,528. And today also, the Nomina Anatomica is being revised, and presently it is a 6th edition. And similarly, for standardization of histological terms, there is Nomina Histologica, and for embryology, Nomina Embryologica. So now let us move forward to anatomical terms. Most of the anatomical terms are given in Greek and Latin. And first is anatomical position. In anatomical position, whatever the description of the human body is given in the books is with reference to the anatomical position. So this is the standard position. In this position, the body is erect, standing, looking straight at horizon. Both the feet are parallel to each other, and both the arms are closer to the body, but palms facing forward. So this is the anatomical position. There is another position where normally when we stand, we keep our hands not palms facing forward, but palms facing towards the body, and this is called fundamental position. If you make the body sleep in anatomical position, it is called supine position. And if you turn the body upside down, then it is called prone position. Another position is called lithotomy position. This is specially used in the gynecology and urological side. Then comes anatomical planes. The first plane is mid-sagittal plane or median plane. Mid-sagittal plane is a plane which divides the body into two equal left and right half, and any plane parallel to that is called sagittal plane. Then comes coronal plane, which is also called frontal plane. Coronal plane divides the body into anterior and posterior half. So it divides the body parts also into anterior part and posterior part. Then comes transverse or horizontal plane, which divides the body into upper and lower part. So here you can see that this is a transverse plane. And then comes oblique plane. Any plane which does not follow any of the above mentioned planes is called oblique plane. Some terms used for relationship. First is superior. Superior means towards the head. Anything towards the head is called superior. For example, if you compare the shoulder joint from the knee joint, you can say shoulder is superior, knee joint is inferior. Then comes inferior means away from the head. So knee joint is inferior or towards the toe. Anterior. Anterior means in the front of the body. Posterior, towards the back of the body. Medial, towards the midline of the body. Towards the mid-sagittal plane of the body is called medial. Away from the mid-sagittal plane of the body is called lateral. So example is heart is medial and arms are lateral. Proximal and distal. Towards the trunk or towards the joint, for example shoulder joint or hip joint, this is moreover this term is used in the relationship with the limbs. So towards the trunk is called proximal and away from the trunk is called distal. Shoulder is proximal, elbow is distal. But when we compare elbow and wrist, we can say elbow is proximal, wrist is distal. Then comes superficial. Towards the surface of the body is superficial and away from the surface of the body is called deep. Skin is superficial, muscles are deep comparatively. But when we compare the muscle and the bone, we can say muscles are superficial and bones are deep. Then comes ipsilateral and contralateral. Ipsilateral means the half of the same side and contralateral means the half of the opposite sides. So, certain terms are used in relation with the embryo. Ventral means anterior surface of the embryo, dorsal means posterior surface of the embryo, cranial means towards the head and caudal means towards the tail. Commonly used terms to describe the movements. Flexion. So when the movement is happening at the joint, if the angle is reducing at that joint, it is called flexion, as you can see in the elbow, wrist and knee joint. When the angle is increased, coming back to the normal anatomical position, that is called extension. Adduction. When the movement is happening towards the median plane is called adduction. And when the movement is happening away from the median plane, that is called abduction. A rotation towards the medial side is called medial rotation, and the rotation away from the medial side is called lateral rotation. Circumduction. When all the movements are happening together in a circular manner, it is called circumduction. Supination and pronation. This is a specialized movement happening only in the forearm. When the palm is facing forward, it is called supination, and when the palm is facing backward, it is called pronation. Inversion and eversion. This is happening at the ankle joint and precisely at the subtalar joint, because ankle joint is a hinge joint and the only movement happening at the ankle joint is the dorsiflexion and plantar flexion. But this inversion and eversion is happening at the subtalar joint. When the foot is facing inside is called inversion, and when the foot is facing away is called eversion. Protraction and retraction. The projection of the body part forward is called protraction and backward is called retraction. As you can see, protraction of the mandible and retraction of the mandible. Invagination. Something going inside the surface is called invagination and something popping out is called evagination. Some terms used in the clinical anatomy. First is symptoms. Symptoms are the complaints of the patients. Whatever patients tell you their complaints, that is called symptoms. Then comes signs. Signs are the findings of the doctor on the patient. Diagnosis is identification of the diseases. Prognosis is forecasting the probable outcome of the disease. And therapy is the medical treatment. Another certain terms used in clinical anatomy are inflammation, that is a local reaction due to tissue injury. It is always suffixed by itis, for example, appendicitis and tonsillitis. Inflammation of appendix is called appendicitis. So here you can see that inflamed appendix, which is called appendicitis. Ectomy, a removal from the body. We do surgery and remove the appendix after the surgery, that is called appendicectomy. When you remove tonsil, it is called tonsillectomy. Otomy, that is to open and close the organ. So when we do appendicectomy, we first open the abdominal wall, we remove the appendix and we close it back. So that is called otomy. So it is called laparotomy. If we keep the part open after the surgery or after the procedure, then it is called ostomy. For example, trachea. We put a tube in the trachea and we keep it open, that is called tracheostomy. So finally, this brings us to the end of today's lecture. I hope you guys had a lot of learning today. Your journey ahead is going to be a bit tough, but with determination, hard work and team spirit, you will definitely succeed. I wish you all the best for the rest of the year, and hopefully we'll have a lot of fun on this channel learning anatomy. If you like today's lecture, please hit the button like. Please feel free to comment on today's lecture, and please subscribe on the channel so that you get a wonderful experience of the channel all around the year. Thank you so much. Thanks for watching this video.